Come on. All right, 1 second. Let's just give me everything set up here. All right, if you're joining, welcome. Just getting things going here, waiting for people to start joining in. Today we're going to be talking about testosterone, replacement therapy, peptides. It's going to be very exciting.
Yes. Two of my favorite things.
Two of your favorite things. Okay. Just letting people know. People are going to start joining in here. Here it is. Awesome. All right, and we're live. All right, guys, welcome in. If you're just joining here, today we're going to be talking about two very exciting things. We'll be talking about testosterone replacement therapy specifically for men. Maybe we'll get into testosterone replacement therapy for women in a little bit, as well as peptides, some of the recent news around peptides, everything you need to know. We're going to be busting myths. Anything you hear on this podcast, this is not medical advice, simply educational purposes only. MedMatrix, we are the largest and fastest growing functional medicine practice in Maine and New Hampshire. So we use these types of modalities every single day on thousands of patients. So we're definitely the authority here in Maine and New Hampshire. And today we're going to start off by talking about testosterone replacement therapy. My name is Cole Seifer. I'm one of the partners at MedMatrix. I'm also the director of marketing. Today we're joined by Dr. Colin Renard. Colin, thank you so much for joining. How you doing?
Good. How are you, Cole? Good to be here.
Good. Yeah, I'm super excited. So
super excited. Yeah, two of my favorite topics.
Yeah, right. Why don't you kick us off and tell us a little bit about let's start with something fun. When was your first introduction to testosterone replacement therapy? Because it's not something that's super, oftentimes we hear patients come in and they're like, they have low testosterone levels. They went to their PCP and they said, oh, you don't need it. So in conventional medicine, maybe there's something that isn't super widely adopted. Yeah. So what was your first introduction to testosterone replacement therapy?
Learning about it and then also treating it, but I have no hesitations about sharing this, but actually personally using it. So that was a big sort of lights on for testosterone and kind of understanding the importance of it and how amazing it can affect patients, me being the patient, but got into doing a lot of hormone replacement when I first started practicing in functional medicine. And unfortunately, there are so many men that need it and also women. And the unfortunate thing is it's just so underutilized. And there's a lot of myths around it in both men and women. There's a lot of misinformation on social media coming from influencers and people that have not a lot of medical experience or medical background. So done a lot of treatment with patients over the years, men specifically with hormone replacement. It's extremely important as they age. So, and also young men, that's where I'm seeing it a lot. We can talk about this separately, but a lot of younger men are having issues with low testosterone. And I get asked the question all the time by patients and that are young or people that are not, that don't apply, but it's like, why is this happening in a 30-year-old man? Why does he have low T? So, it's a huge change in the way we live in our lifestyle. And we can talk about this further, but very, very interesting to really understand the ins and outs of testosterone therapy for older men and young men and women as well. So.
Yeah, totally.
Yeah.
Where do you think the gap is between, I guess why is testosterone poorly addressed in conventional medicine?
I think this just goes back to, and we talk about this all the time, especially in all of our platforms on MedMatrix and us as providers in functional medicine, is the conventional medical model or the conventional healthcare system just doesn't do a great job about addressing longevity in healthcare. They are so good at saving your life if you've been in a car accident, if you need an operation, if, something urgent, something acutely wrong, an emergency. But when we talk about longevity, when we talk about the proper aging that people do or need to do, it is just lacking in the way healthcare is administered, especially in the United States. It's not like that around the world. So
Hmm.
I think it is a philosophical problem of the mainstream or conventional medical system where they're not taught, and they just do not know how to look at a person and say, okay, how can I optimize their longevity? How can I optimize their aging process? How can I make them feel good as they age? So I think that is where it lacks. Um, and hormone replacement for men and women, whether it's testosterone or women's hormone replacement, that's just part of longevity. So it's a missing piece, right? It's just not part of the conversation at all. So I think it really gets missed for a lot of people.
Gotcha.
Yeah.
Let me see. Just pulling on my show notes here. Um, what roles do testosterone play in the body? Like, why is this actually an important hormone? Like,
It,
what are the when you have low testosterone or
yeah.
suboptimal testosterone? How does that actually throw things off?
It throws a lot of things off for both men and women. I know we're focusing more on men, but we'll talk about women too. So, testosterone uh, sort of gets the stereotypical, well, it's good for muscle strength, it's good for sexual health, erections. Yes, that's part of it, but some of the main symptoms for low testosterone, specifically for men, are fatigue, not feeling as strong, like feeling run down. Depression's a big one, irritability is a big one. And then also changes in the body habitus, meaning the way you physically look. So less muscle mass, more abdominal or visceral fat. And then also what can happen is symptoms of estrogen dominance when the testosterone is low. So we call it gynecomastia, but the layman's term is man boobs. That's a very common symptom of low testosterone. And also just the overall change in, like I said, the body habit. It's not having as much muscle mass. Similar symptoms for women. Women experience decreased libido. They get fatigue. They get depression, irritability. Women can notice changes in their hair, changes in their skin texture. And also a big thing is issues with vaginal dryness or pain with intercourse. So testosterone is extremely important for both sexes. And we can talk about how that applies as they age and how it changes. But those are some of the most common symptoms we see with testosterone reduction.
Gotcha. Um, why does low testosterone cause man boobs? Like, what's going on physiologically?
So I hate to use that term because I don't want to be offensive, but gynecomastia or man boobs is caused by an accumulation of of fat in the chest. So when there's fat accumulation in the chest of a man, it can create the appearance of boobs like a woman has. And why this happens is men can have an overproduction of estrogen. So
Mm-hmm.
when they have an overproduction of estrogen and also another hormone called prolactin, what happens is the body starts to store fat in the chest area. So you have this very loose skin, loose tissue there, and it resembles breasts, and it is one of the most common physical signs of significant hormone change. And that comes along with other things of insulin resistance and other problems in the body, but that's one of the main reasons why. Very
Gotcha.
common symptom. Very common symptom. See that all the time.
Okay. Gotcha. How often do men have low testosterone?
Very often. I see this a lot. And unfortunately, we're seeing this a lot more in present day for a lot of different reasons, which hopefully we can touch on why this is happening. But more than people think,
Mm-hmm.
men have low testosterone. And unfortunately, this is another part of the conventional medical space that is lacking is when we do tests, we have laboratory data about anything, whether it's a blood marker, an inflammatory marker, a hormone, thyroid hormone, whatever it is, there's a reference range, right, of what it should be. And most in the conventional health space look at that reference range as being normal, which it is. But in the functional world, what we look at is optimal. So this could be normal, but is it optimal? Is it low normal? Is it in the mid range? Is it high? And that matters. So an optimal range is what we're really trying to understand from a hormone perspective. And again, the conventional medical space just does not do this. So to give you an example, testosterone is optimal for a man at any age, a total testosterone level between about 700 and 1,000 on a blood work. So if people have had blood draws and they're seeing these numbers, that's what that means. So the reference range of testosterone, though, on a lab is 300 to 1,000. So if a man in his early 40s, something like that, has a testosterone of 320, a conventional doctor may say, oh, yeah, you're totally fine. Oh, but I'm fatigued. I'm not sleeping well. I have decreased libido. No, but your testosterone's normal, so you're fine. Yeah, but he's not, though. That's the thing. So the conventional doctor may say your testosterone at 320 is normal, but it's certainly not optimal. He could, in theory, double that number and be 600, even 900, and feel much better. So we are seeing a lot of low testosterone, but then we're also seeing a lot of suboptimal testosterone. Like I said, in both men that are older and younger men too, 20s, 30s. So there's a lot of low T out there, unfortunately, and it's being missed by a lot of people.
Gotcha. How is that set up, like in the conventional medical system?
Yeah,
Like, a lot of people wonder, like, okay, why is this even a problem? Why are these reference ranges on labs so low? Like, why are they actually waiting
that's a
for you
great
to have?
question. Yeah, because that's again going back to sort of the medical model of healthcare is, and not saying there's anything wrong with it, but it certainly doesn't allow people to live optimally. Um, The problem is if the reference range goes so low, then you can be normal but still low. So that it's just another downfall of the medical system in the way the philosophy of healthcare is we're not looking for optimal. So these reference ranges are created by data of millions of people, and they create these reference ranges based on what the average should be. So that's where these reference ranges come from. It doesn't look at what's optimal. It just looks at averages over millions of data points that have been collected over years.
Mhm.
So again, if we were to shift these reference ranges, it would have to be for something that's optimal. But again, there has to be literature to support that. There has to be a huge shift in the philosophy of healthcare. So that's why some of these reference ranges don't reflect optimal levels, which is what we do as functional medicine providers. That's the way we approach patients is optimal.
Yeah. So what's the difference between the way like a functional medicine provider like yourselves approaches low testosterone versus now there's all these like men's health clinics popping up
Yeah,
that'll pretty much shoot anyone who comes in the door with TRT? Like
yeah,
what what like what's different? Like what are you getting opposed to going from like, just any testosterone clinic because they're out there.
yeah, yeah. Testosterone and hormone only clinics, no disrespect, but a lot of times what's happening is they're just giving a very standardized dose of testosterone for any guy that walks in the door. It lacks a personalized approach to their health. It lacks looking at other issues that could be going on with the man's health. So, for example, a lot of men that are older, say 50s, 60s, middle age somewhere, that are not in optimal health, right? They probably have low testosterone, which could be corrected, which is great, but they probably have a lot of other things going on too. They probably have insulin resistance. They might be pre-diabetic. They probably are not eating well. They might not be exercising. Maybe they drink too much alcohol. Maybe they smoke. All these factors that are involved in their health and their lifestyle contribute to testosterone optimization. So if you're just focusing on one variable, strictly the testosterone itself, that is a part of it, but a man's overall health is really where we want to put a lot of our effort too, because we want to try to optimize the body's ability to use testosterone.
Mm,
just giving it as a replacement and hoping everything else self-corrects, that's not how this works. You can't take testosterone and just live a poor lifestyle, be stressed, get no sleep, not eat well, not exercise. Similar to what we're taught about weight loss drugs. You can't just take a weight loss drug and do everything you do in terms of your lifestyle and expect a good outcome. It's not the way it works. So very similarly to the testosterone problem with these testosterone clinics, we really need to optimize all of the person's health, both a man and a woman. It's really important.
okay. What are
Yeah,
the other important things that you're looking at with testosterone? Because it's not, because yeah, it's like people are very myopic. Like, okay, testosterone is the only number that matters. What are the other
right.
numbers that are either affected by testosterone or contribute to testosterone that, providers should be really looking at and things that
Yeah,
you're looking
there's a lot of things, and as a functional medicine provider, that's really where we shine to look at these other things. So, big things are your physical activity. Do you exercise? Specifically, do you weight lift? Right, weightlifting is one of the best ways to increase your testosterone. Do you sleep well? Do you sleep at least 7 to 9 hours a night? What's your diet like? Are you eating enough protein? Are you eating enough good protein sources? Are you eating enough fat? Is your vitamin D level normal? Most people are not. Most people in northern New England, New Hampshire, Maine, Massachusetts, especially during the winter months, right? It's December, it's January now. Sorry. Happy New Year, everybody. It's January now. So, um, dead of winter, no sun exposure, their vitamin D is low. We need to talk about stress. We need to talk about alcohol consumption. We need to talk about cigarette smoking.
at?
Um, like I mentioned earlier, if people are pre-diabetic, if they're insulin resistant, if their cortisol or what their stress hormones are abnormal, all these things play a role. So we need to look at
Gotcha.
all these things together.
So if you're a guy and you're like, maybe you got a stressful job, you got a bunch of kids, like
Yeah,
stressful, like modern day life is stressful in general, right? How
totally.
can stress impact your testosterone levels?
Stress is one of the biggest factors that impacts everything in the body, not just testosterone, but hormones in particular. So, stress works on what we call an axis. It's an HPA axis. It involves different organ systems. So, what stress does is at a cellular level, it starts to burn out your cell's ability to function. It burns out your stress hormones. And also, it is one of the most common reasons why hormones can become low. So, stress, stress is one of the most toxic things on the body, both physically, mentally, spiritually, physiologically. So, stress plays a huge role in how hormones interact with each other, and also how well they are optimized and they function. So, if you have a high stress job, if you have a high stress life, which a lot of people do, and it's really hard to educate people on that, right? They can't quit their life, they can't quit their job, they can't
Yeah, I
leave
was
their
gonna say
family.
if you have like a high stress job, high
So,
stress life, like you
yeah,
can't just
you can't
choose a
just
new life.
quit, right?
What
Yeah,
do you do?
yeah.
Are there things you can take? Like obviously you can meditate. Like
Yeah,
what are the
you
things you
have
tell
you have
patients?
to try to as functional medicine providers, that's part of our job, is understanding that people cannot live a perfect life, right? If we all could live a perfect life, I wouldn't have a job, right? You wouldn't need me. So my
Sure.
job is to not only provide the medical treatment for patients, but it's also to educate them about things that they can do. So high stress life is pretty much everybody, but we need to understand how we can make little changes. So, little changes in your day to day, little changes in sleep. If you can get better sleep, that can be helpful. If there's ways you can be more mindful, if there's ways you can practice meditation, if there's ways you can practice more self care, even if it's 5, 10 minutes a day, over a lifetime, that makes a huge difference. So, part of it is trying to work with the patient and trying to figure out where there's little ways to make change. And that's the best way. There are certain supplements that we use to manage stress. One of my favorites is an adaptogenic herb called ashwagandha. Ashwagandha helps increase your testosterone, helps manage stress. So there are little things that we try to do to help people. But no, life is not perfect.
Does ashwagandha actually work though? Because I mean that's like one of the things you hear like all the time online. It's pretty popular. Like how like truly how effective is
It's
ashwagandha?
if I have a man with low T, am I gonna say go take ashwagandha and your tea is going to be better? Probably not. But it can be very helpful as an adjunct. And it is one of the herbs that has been shown to improve and optimize testosterone levels. There are also other herbs that I go for. A couple that come to mind, something called Tonkat Ali, fenugreek, ginseng, vitamin D, magnesium. That's not an herb, but vitamin D, magnesium, zinc. These are all things that men can take. But when we understand testosterone depletion in a man, it's really understanding the man himself, right? So, how old is he? What is his lifestyle? What other issues are going on? Is he pre-diabetic? Is there a thyroid problem? Is he overweight? So, there's a lot of things that are involved, and that's why these sort of one-stop shop testosterone clinics, in my opinion, don't do a great job at assessing a man's need, is because they can just give T. Sure, great, but what about all
Hmm.
these other things that need to be done? So there are things that can be helpful, but 9 times out of 10, especially for a man who's of a certain age, they really need proper testosterone replacement. And we
Okay.
can, as an aside, to give a little statistic on this, men over the age of 30 to 35 start to lose their testosterone by about 1 to 2% per year. So if you're 60 and you have low T, you could be doing all the right things with diet, lifestyle, eating well, taking herbs, taking all your supplements. You still may have low T because it's just part of the natural aging process. So that's where we need to take into account, okay, what can we do to get this man optimized? Well, he probably needs testosterone. There's not a lot that can be done to fight off the aging process, but it is also inappropriate to try and hormone replace a man's poor lifestyle. So you have to work with what you have with the patient.
Okay. Where's the fine line of when you say, okay, let's not do testosterone replacement therapy
Hmm.
and try other
Yep.
modalities versus, okay, you almost, if you want to feel optimal, you almost need to do testosterone replacement therapy. Where's that line?
So age can be a fine line for sure. So for example, and this happens to me a lot, and I see a lot of patients at Med Matrix that fall into this, is men who are younger. So, and we can talk about this separately, but a lot of younger men, 20s, early 30s, I've even had men that are 18, 19 that have low testosterone. And we can talk about why that is separately. But younger men that have low testosterone, if there isn't some sort of, blatantly obvious reason as to why, like an illness or, cancer, something more dramatic that could be causing low testosterone, um, often it is not advised to give testosterone replacement because it can, doesn't mean it will, but it can affect fertility in a younger man. So if a man is 22, 23, even 30, and he is still of childbearing years or interest in having children, it may not be an appropriate thing to give straight testosterone, because when you give straight testosterone to a man, your body's ability to naturally produce it goes down. That is reversible, but still, it's not my job to kind of play God and potentially affect a man's fertility ability. So we use other medications to improve testosterone. We use other oral medications that can improve testosterone without actually giving testosterone. So age is a big factor, but then also if there's a history of prostate enlargement, a history of prostate cancer. Testosterone has not been linked to prostate cancer, but you still have to be mindful of those things. So um, there's definitely some factors. Age is a big one, though, in terms of how we treat. Oh, Cole, we can't hear you.
My bad. So on
There
the
you
flip
are.
side, what's
Yeah.
like the um, who's someone who like needs testosterone replacement therapy and that's not getting it from there? Because eventually, if you have like testosterone levels of like 50, then insurance will cover it. But who's
Yep.
someone who's like insurance wouldn't pay for testosterone replacement therapy that like actually needs it, and if they did it, they would feel so much better.
Um, so most of these guys that need it, um, like the let's say stereotypical or average guy that needs it, is maybe midlife or slightly beyond, right? 50 to 60. Health has not been a huge importance for that person. Maybe they eat decently, but they're not totally on board with eating well. maybe they try to exercise a little bit, but not really. They're probably overweight. They're probably a little bit insulin resistant, right? They have high cholesterol. Maybe they have high blood pressure. Sort of a very average middle-aged man that does not take health as seriously as he should. And he goes to the doctor not feeling too great, right? Maybe he's on blood pressure medication. Maybe he's on a diabetes medication. Maybe he's, trying to diet, but not doing the right things because he needs to lose 50 pounds. And by some chance, right, his primary care doctor runs a testosterone. Maybe for a guy like this, it's 350, right? We talked about the reference ranges. They go typically a 300 to 1,000. So his doctor says, "Oh, yeah, your testosterone's fine. I'm sorry you're not feeling well, but keep trying to lose weight, keep trying to eat well, come back to me in 6 months," right? No answers there, right? That's the guy who needs T, 100%. This is the most common patient that I have on testosterone is a man that fits into those demographics for sure. Like I said, there are other men, younger, 30s, 40s that need help, but most guys that I see, and I think that we see here at Med Matrix, are those demographics, and those guys need T. And they're, like I said, they're being under treated by their primary doctor or someone that's monitoring them because their levels are normal, but they're very suboptimal.
Okay, gotcha. And for those people, they're going to be on it for the rest of their life.
So that's a thing that men have to wrap their head around. Is when you start hormone replacement, it's usually a lifelong commitment. So if we think about it, right, if men's testosterone reduces by 1 to 2% every year after age 30 to 35, you're fighting with a natural decline of your hormone levels just as part of the aging process. So if you're 50 and you have low testosterone, you can do some things. As I said, we could get you to lose weight. We could get your diet perfect. We could get you in the gym 5 days a week, lifting heavy weights. We can optimize your supplementation. All of that is going to help, right? Maybe a 320 testosterone level in a guy who does all those lifestyle changes for a year will bump up to 400, something like that. Is that still optimal? No, it's not. So, and there's a lot of new evidence to prove that. So, when I educate men, I say, listen, you can do all the right things which you need to do. It's dramatically important. But when we talk about just the natural aging process, you are losing it over time. So, testosterone is a tool that you use to improve longevity and improve hormone health and improve your overall health. So, yes, it's a lifelong commitment, but it is a lifelong tool that helps you feel good and feel optimal and help your longevity, help you not only live longer, but feel good living longer. So it is something that men can sometimes struggle wrapping their head around. But the thing is, once they get going on it, they don't care how long they have to be on it. So,
And are there any like side effects, risks to being on
no.
testosterone for no?
No, there
Why?
is some common, yeah, there's some common misconceptions that testosterone replacement causes prostate cancer. It does not. There's plenty of data to support that. And then there was actually a study. It's called the Traverse trial. It was done in 2023. It was a very large study that showed testosterone did not cause increased risk of heart attacks, strokes. And there's also been some separate reports that it does not increase your likelihood of developing prostate cancer. Um, Testosterone replacement can cause an increase in the size of a man's prostate over many, many years, right? If a man's on T for a month or 2 months, it's not going to increase his prostate size. I'm talking about decades. And that's just something that has to be monitored, with certain laboratory tests and physical exams. So, not something that should sway anybody from not doing it. There's actually
Gotcha.
studies that show men that have low T are more at risk to develop some sort of comorbidity with age, a heart attack, a stroke, cancer, because the absence of the hormone is driving poor health long term.
Gotcha. Where's the fine line of like too much testosterone? Because you go to the gym and you see some guys who look like a Greek god? Like, is too much
Well,
testosterone ever a
that's
bad
probably
thing?
other things sprinkled in there that are
Sure,
not
yeah.
legal, and we won't talk about those. But too much testosterone can be a bad thing. You want to find the sweet spot. Like I said, we are aiming for, and the way my approach and sort of a general approach at MedMatrix is the physiological range. So on paper, that is usually between 700 and 1,000 of a total testosterone. Um, Also, it's how a man feels, right? That's that plays a lot into it. So that's why it's really important to measure labs and do adequate monitoring. And when most men get at a good dose, they stay pretty consistent with their hormone levels for a long time. So you don't have to check levels like every week or every month. Once we get people on a good testosterone dose, twice a year, once a year for some men is adequate monitoring. But there are also risks of increase in red blood cells. When there's more testosterone in the body, there's an increase likelihood that more red blood cells will be made. So that's why adequate monitoring is important. And in those cases, we might just recommend the man donate blood. But if levels are too high, it can actually backfire with mood. It can make you feel worse. It can make your skin really oily, breakouts. It can, like I said, affect the red blood cells a little bit. And then also, if levels of testosterone are too high, we can see a dominance of estrogen because testosterone converts to estrogen. So if there's too much testosterone, then you'll have too much conversion of estrogen, and then you can have estrogen symptoms, which can
Okay.
affect
When
mood.
is
Yeah.
Sorry, but that was a great
Oh, you're
explanation. But
good.
when is estrogen actually a problem? Because like I hear a lot of guys talking
Yeah.
about, oh my gosh, too much They're like super afraid of estrogen. How like does estrogen only become a problem when there's symptoms, and some guys can
Yeah.
actually have high levels of estrogen? Like, walk me
Yeah.
through estrogen.
100%. Estrogen is another common misconception problem in the health and then the hormone replacement world for men. Um, we do not, repeat that, do not want to lower estrogen too much. I see a lot of men, and a lot of men have come to me to take over their hormone replacement where they have been on estrogen blockers, aromatase inhibitors. It's sort of, again, no disrespect towards the testosterone only clinics, but that is a big part of what they do. They give the hormones, the testosterone, and all their men get estrogen blockers. Do all men need it? Absolutely not. I think most men do not need estrogen blockers. And there's actually a lot of data to support this. And some of the top hormone people in the functional and integrative space and the biohacking space right now are saying we need to optimize men's estrogen, which I 100% agree with. So unless a man is symptomatic of high estrogen, if his estrogen is a little bit on the high side on labs or even out of range high, but he feels good, don't care. Don't care. Leave it alone. Continue to monitor it. Do not start on an estrogen blocker because estrogen is really, really important to maintain a man's mood. Believe it or not, men need estrogen to maintain and get an erection. I educate men on that all the time, and they're like, "Oh, that makes no sense." That is 100% what it's needed. So it's all about monitoring, right? If we get the levels in a nice range, they stay in a nice range. Most men do not need estrogen blockers.
That's interesting.
Yeah.
Yeah, I mean, if you're in this space, you hear it all the time of like everywhere's they're super afraid of estrogen.
Yeah.
So
We need to
wrap,
get rid of that.
yeah. So if you're just joining us, guys,
Yeah.
we're talking about testosterone replacement therapy, specifically around integrative and functional medicine. We're coming up on the end of this segment. Then we're going to talk about peptides. To wrap up this segment, we're going to talk about one comment we got from David Grant. So again, this is not medical advice. This is just for educational purposes only. So David's saying, my testosterone is 88. PCP referred me to urology, and neither of them are taking me seriously. So I've ordered QO Core supplements because my girlfriend and I are trying to get pregnant. I'm only 32. It sucks. Doctors won't take you seriously at all.
Wow. And testosterone of 88. That's extremely low. Wow.
So let's say this patient came in. What
Yeah.
would you do with the functional approach? help this
Well, the
patient?
functional approach of sort of the way the med matrix way is not just looking at his testosterone, but looking at other things, right? With a testosterone of 88, we want to understand if there's something else going on. Is there insulin resistance? Is there some sort of exposure that he has? Is it a mold exposure, toxin exposure, some sort of chemical exposure, something that's driving the levels that low? Because that is very low. I mean, I've seen 30, 40-year-olds with 200, 300, but double digit testosterone numbers below 100, that's markedly low. So we really need to understand him and his environment, exposure potential, other hormones, blood sugar, all the other ins and outs of the body, the stress levels, the stress hormones. So if he's trying to have children, he's the perfect example where we may use oral medication to increase testosterone naturally versus actually give testosterone. But again, this is just not part of the healthcare system approach. So I'm sorry that he's really struggling, and he definitely needs a comprehensive evaluation that's not just his testosterone, but really understanding him as a person, everything else. Is there something else driving this? Is he exposed to something? Yeah, there's a lot to understand there for sure.
What are examples of oral medications that you've used in the past for patients who are younger who don't want to go, or just people who don't want to go on testosterone replacement
Yeah.
therapy?
The
Period.
the most common thing that we use is something called enclomiphene. It is a fertility drug. What it does is it stimulates sperm production, and it's used in the conventional medical space to help men that have fertility issues. So if this person found a smart urologist or another provider, they may say, "Oh, if you're trying to have a kid and you can't, go on this medication." And that's something that he probably needs to do. He definitely needs to do. So something like an oral enclomiphene is one of the best ways. Very, very low side effect profile. It's the best way to naturally improve testosterone because, as I said, it increases your sperm production. So testosterone is made in the testicles in the same cells that sperm is made. So when you increase sperm production, you are indirectly increasing your testosterone.
Hmm.
Yeah,
That's good
without
to know.
affecting
Cool.
fertility. Yeah.
Yeah, total night and day difference.
Yeah.
Cool. That concludes the testosterone replacement therapy section. If you're listening to this live or recording of this, if you're interested in becoming a patient, you can go to the website. You can click Get Started if you're ready to rock and roll and talk to a patient coordinator, or you can click Pricing and actually create a personalized, get a free personalized treatment plan, get an idea of, what to expect financially, what things we could do for you. So if you're interested in becoming a patient, go over to medmatrixusa.com. Just look up MedMatrix. Will come up. And we'd love to hear you. So, all right, if you're just joining us now, we're moving into talking about peptide therapy, some of the recent news, a lot of things around peptides, what's true, what's not. And yeah, so my name is Cole Seifer. I'm one of the co-founders of MedMatrix. I'm also the marketing director, and I'm joined with Dr. Colin Renard. Colin, thank you so much for joining for the second segment.
Everyone, thanks, Cole. Yeah, thanks for having me. Peptides are a hot topic right now, so I'm happy to dive into this with you.
Yeah, bring me back in time to your first introduction to peptides, because this wasn't something that was taught in conventional medical school, right?
No, it's actually fairly recent. In my career as a functional doctor, this is something that is fairly new for me too in the last few years. Because they've always been there, but really the advent of, I think, social media has really allowed peptides to explode, and that's a good and a bad thing. There's a lot of misinformation out there, and we can talk about the specifics of that. But I started understanding the role of peptides when the weight loss drugs came out. So the GLP-1s, because those are peptides. People don't really understand that, but Ozempic, Mounjaro, Wegovy, those are peptides. So GLP-1 or the GLP-1 GIP, or which is tirzepatide, those are peptides that affect weight loss. So those are hormone receptors. Those letters that we talk about, GLP-1, that's a hormone receptor. So when these really came on the scene and we're really trying to like deconstruct how these all work, then the other peptides really started to follow, because the peptides work incredibly well, have not a lot of side effects, some of them. So that's where I started to really get involved, and then my own personal journey of bodybuilding and working out really is where I started to learn about some of the peptides that are used in more of the athletic world, growth hormone, peptides, bodybuilding peptides. So it just kind of exploded from there. And then also patients start asking, have you heard of this? Have you heard of that? I saw this on Instagram. I saw this on TikTok. And then me as their doctor, it's like, I have to learn this. So I took it upon myself, not only for personal use and personal knowledge, but I had all these patients wanting to know all this stuff. So it really exploded in the last 2 years, last 5 years, definitely. But the last couple of years, it's really exploded.
Gotcha. Um,
And we can talk about what peptides are if people don't know.
yeah, I was gonna say we got a little ahead of ourselves. So let's go
Yeah,
back.
we got a little ahead. Yeah. So if we want to talk about specifically what a peptide is, a peptide is basically a short chain of amino acids. So amino acids are chemicals in the body that come together to make more known as a protein. You need amino acids to make proteins, but that's a long chain of amino acids. A short chain of amino acids is a peptide. And peptides act, well, they occur naturally in the body, and peptides also occur naturally in foods, but they play roles, like I said, at affecting certain hormones, certain receptors on the body. And most peptides, I mean, there's a lot out there, but most peptides can affect cellular function. They affect some sort of signal. They affect hormone production. And they also are used to build essential structures like collagen, elastin. They're popular in promoting skin health, muscle repair, also immune response and immune regulation. So those are common things that peptides do.
Gotcha. Um, so why are peptides such like a advancement in the healthcare space? Like why, like, yeah, walk me through the difference between like peptides and like a normal pharmaceutical.
Yeah, yeah. And the question I get a lot too is what's the difference between a peptide and like a supplement or like an herb? So a pharmaceutical is a synthetic molecule that's made often to turn something off in the body, right? Turn off some sort of enzyme, turn off some sort of metabolic pathway. And it's a synthetic molecule. So a peptide differs in that where it's not synthetic and it's a very short um, amount of amino acids. So what these amino acids, like I said, are doing is they're affecting a receptor and they're often causing some sort of upregulation or they're allowing something to work better versus a medication often turns something off. So we don't always want to turn stuff off, right? The body is the body. It's supposed to function. It's supposed to do what it's doing. We don't want to turn everything off in the body. Then what are we left doing? So the difference between a peptide and say a supplement, and some peptides come as oral supplements. I want to make that clear. We can talk about that. But a supplement is usually some sort of a vitamin, right? Or an herb or a plant chemical. Those are actual physical substances that are derived from, like I said, an herb, a plant, whereas a peptide is more of a microscopic compound of these amino acid chains. So there's a lot of science here, and I don't want it to get too confusing and too bogged down on the weeds, but those are some of the basic differences.
Gotcha. Okay.
Yeah.
That was a good explanation. Can you explain what bioidentical means? Like peptides are bioidentical. Like what does that mean?
Well, bioidentical, and this goes back to our hormone talk too, but bioidentical is a term that means it is identical to something your body produces. So not to go back to what we were talking about, but testosterone, but we use bioidentical hormones. That is one of the pinnacles of the med matrix philosophy. We do not use synthetic anything because synthetic hormones have been linked to cancer. So bioidentical means that the compound has been created to mimic the exact compound your body makes. So it's used as a tool. It's used as an addition, a repletion of something that's deficient versus a synthetic thing that your body has to metabolize and try to work through and utilize that it's not really supposed to be there. So bioidentical is a huge important thing when we talk about hormones and peptides. You want to be using bioidentical always.
Gotcha. Yeah. All right. Now let's get into like this is such a hot topic. What's the difference between research peptides you can get for like $50 on on the internet versus like the FDA 503 A and B pharmacy peptides that we prescribe to patients at MedMatrix? What's the difference?
So there's a lot of differences. You talk about the FDA. Some peptides are not FDA approved. Some are. The ones that are most commonly seen that are FDA approved are, like I said, the GLP-1s, some of the weight loss drugs, and some of the other ones that we get from compounding pharmacies. So there are a whole lot that are not FDA approved. So this is a big thing, and I want to say it's an issue because there are so many people in the social media world, influencers, and we can put that word in quotes, right? Because they profess peptides, but they may have a lot of experience with them, and that's fine, right? You can be a non-healthcare, non-licensed healthcare provider and have experience with healthcare themes, herbs, nutrition, peptides, hormones, but as a person without a license, right? I have a lot of licenses, I have a lot of board certifications. I have to maintain a certain level of um, professionalism within my licensing ability to give things to patients that are considered safe and are considered efficacious. So when we talk about things that are not FDA approved or promoted on social media by certain people that have really no license to do so, they can just talk about whatever they want because they can't get in trouble with anybody. A lot of these things come from unreputable sources. We don't know how they're manufactured. We don't even know if what's in there is what they're saying, right? You could go on some website for a peptide and they're advertising BPC or, a GLP-1. Is that even what's in that file? You have no idea because these peptide companies are often marketed as research only or non-human consumption. So in theory, they're advertising this non-medical product when the problem is we really need to be doing something that is approved, that is pharmaceutical regulation, that is overseen by a provider, the dosing is right. So that's really the big issue is you don't know what you're getting. And, there could be heavy metals in there, there could be toxins in there, and you're really kind of going in blind without guidance on dosing that's appropriate for you. So it's a bit of a big issue, especially if you don't know what you're doing. And there's a lot of marketing to people that are, for lack of a better word, desperate. So it becomes a huge problem.
Gotcha.
Yeah.
Is there yeah, thanks for the clarity there. Is
Yeah.
there ever a time with peptides where someone like should not take peptides?
It depends on their history. So that's why it's really important, like we said, and this isn't an advertisement for us, but when you're going to some of these clinics that just offer hormone replacement or like, yeah, we'll get you on peptides um, without any other medical background, without any other history, without any other understanding of the person, it can be really inappropriate because you're not understanding how that peptide how it may affect that person. You don't understand their health history. So
Mhm.
there aren't blatant contraindications with certain peptides, but certain ones there definitely are that are more mainstream. So like the GLP-1s, the weight loss drugs, there are contraindications to those. So if your health history is not fully understood, there could be dangers there for sure.
Could you give
And
me an
I
example of a counterindication of a GLP-1? Because literally, like, you can go online and just go, like Hims, Hers, Row. There's all these. You can go online, get pretty much any GLP-1 you want without testing, without seeing a provider. What are the actual counterindications of a GLP-1 where you should not be taking the GLP-1?
Yeah. So this goes back to the person's, personal or family history. So GLP-1s or the weight loss drugs are contraindicated in a few people. Specifically, if the person has a personal history or family history of medullary thyroid cancer or multiple endocrine neoplasia syndrome type 2 or MEN2. Also, if the patient has a history of anaphylaxis to GLP-1s, which they would have had to take it once before, um, pregnancy, because there's some studies that show there's risk to fetal development. There's some other cautions that are not strong indications, but if a patient has a lot of significant GI issues, something called gastroparesis or slow gastric motility is a bit of a red flag. If the patient has a history of severe pancreatitis, if they have certain kidney disease, and then also you have to understand the patient's medications that they take, if there's contraindications with certain medications. So it is something that most people can safely take, but that's why understanding a person's background and medical supervision is really, really important. So,
Gotcha. Okay, going
yeah.
a little deeper, what are the because whenever, for Med Matrix at least, new patients, they do a lot of lab work with us on their first appointment. What are important lab markers that you're looking at on patients
Mhm.
who are interested in peptides or when you're considering peptides?
Well, depends on the peptide. So if we're using peptides that are more for inflammation or soft tissue repair or skin health or longevity, anti-aging, there's not a lot of lab work that needs to necessarily be done for those, aside from just normal liver function, kidney function, which would be done anyway with any patient. But for some of the weight loss drugs, the GLP-1s, those are a bit more involved. You really need to understand the cholesterol levels. You need to look at blood sugar levels because you want to make sure there's no issues with hypoglycemia or low blood sugar. You want to look at their thyroid hormones to make sure that there's normal thyroid hormone at baseline. And you also want to look at pancreatic level, pancreatic function tests. GLP-1s can affect the pancreas rarely and without close monitoring, of course, but you want that stuff as baselines for sure.
Gotcha. Okay.
Yeah. But most of the peptides we're using, like I said, for the more wellness space that are not weight loss specific. So, your anti-inflammatories, your skin supportive, your muscle mass supportive. Not a lot of laboratory monitoring is needed, other than basic, like I said, liver, kidney function, blood work is appropriate.
Gotcha. Talk to me about the personalization of peptide protocols because, there's a lot of people out there that they're able
Yeah.
to get peptides online and they kind of like
Yeah.
self-diagnose. They got Dr. TikTok and, they're
Yep.
ordering the Wolverine stack and all these
Yeah.
whatever,
Oh,
famous
one of my
peptides.
favorites.
Yeah. So what, like, can you give me an example of like how personalization and like a pep, because there's a lot of peptides. We have access to a lot of peptides. Um, like, can you give me an example of like what a personalized peptide approach looks like? Um,
Yeah. Yeah. So a personalized peptide approach is really understanding the patient's goals, right? What are they looking to do? And then trying to understand if peptides are the best route for them, right? Peptides are not an overnight solution. So if people are not willing to commit to the work of doing a peptide for many weeks, months, maybe it's not the right thing for you. We also have to consider if they're appropriate because most peptides need to be injected. There are oral peptides that are very beneficial and effective, but a lot of the ones that we use are injected subcutaneously or beneath the skin. So we need to understand a patient's ability to do that, or if they have things that would preclude them from doing that. We also need to understand the patient's other issues, right? We need to understand if we're trying to use a peptide to mask another problem, right? If a patient has low hormones, like a man with low T, a woman that's menopausal or perimenopausal, somebody that's their diet's really bad, they smoke, they drink alcohol. There's a lot of things that probably need to be done first, right, before we consider a peptide. So if a man has low testosterone, pre-diabetic, sort of that average person I was talking about earlier, should they go on peptides right away? Well, it's not that they're inappropriate or that they wouldn't be of benefit to that person, but what's the hierarchy, right? Functional medicine and a personalized medicine approach is all about the hierarchy. What do we need to do first? What are our short-term goals? What are our long-term goals? So a peptide does not outmask, it doesn't outdo a poor diet, right? It doesn't outdo lack of physical activity, lack of exercise. Like I
mhm.
said, if someone's in a low hormone state, it's not going to get your testosterone to 800. So we really need to take into consideration where the person is at any given time in their health journey, and also what their goals are. Most people can benefit from peptides, but it's using them to your advantage. And what I mean by that is using them at the right time so that they work in synergistic with your other treatment and that the body is ready to utilize them. Versus if the patient is in a bad way, their health is not in an optimal level, the peptide is not going to work as well. You're not going to get as much benefit out of it.
Gotcha.
Yeah.
It, with peptides, are they something that you're on for the rest of your life? Like if you start a peptide, okay, now you have to do this peptide forever.
No. No, peptides, unlike hormone replacement, peptides are not something you have to do for the rest of your life. Depends on the goals, right? But a lot of peptides are not designed to be used for long term. Because they affect hormone receptors, you want to use them in a shorter term and something that is scheduled with your healthcare provider because you want to make sure that you're not overdoing it.
Mhm.
We worry about something called receptor burnout, where you're giving too much peptide over a long course of time and the hormone receptor that the peptide affects is starting to become dysfunctional because you're giving it too much signal. So this is where adequate monitoring and timeline works. Um, Certain peptides like the GLP-1s, those can be used for a long term, and most people will probably use them for the long term. But they can be safely discontinued too. So it depends on the peptide and it depends on the goals. But they're certainly not designed for lifetime use, but they can be if they're used appropriately.
Gotcha. So
Yeah.
peptides, walk me through like a typical peptide. Like what would a peptide treatment plan look like on average, as far as like 3 months on, 3 months off? What peptides would
Yeah.
you avoid?
Yeah. So most peptides, let's just say most of the common ones that we use that are not necessarily GLP-1s, because those are not like a 3 month on, 3 month off kind of thing. Those are much longer term use. But some of the more common peptides that we may use for inflammation or for performance enhancement, like, recovery, um, repairment of soft tissues, energy levels, immune response. Those are typically done in like a 3 to 6 month cycle where you would be on it for 3 to 6 months. You're um, monitoring for effects and how people feel. And then there could be a break, right? For 6 weeks to 8 months, 6 weeks, 8 weeks, and then you maybe restart. The thing to remember though is you can't do peptides for too short either. Certain peptides you need at least 6 to 12 weeks on them to really understand their effects. Um, Ones that come to mind specifically, you mentioned Wolverine, Cole. Wolverine peptide is a very common peptide we use at MedMatrix. It's a combination of BPC 157 and thymosin beta 4. Both of these peptides are used in anti-inflammatory for their anti-inflammatory properties. They have very powerful regenerative effects on soft tissues. And these are ones that need to be used over a number of months to really get the benefit for. So again, it depends on the peptide, but that's a typical timing and a typical dose pattern that we would use is you got to be on it for at least a few months and then we reassess after like a 6 to 8 month period. There could be a break of a few months and then a restart.
Okay, gotcha.
And
So
and sorry, I don't mean to interrupt you, but some of the peptides also they're not used every day. So some of these peptides like Wolverine, you're using it 5 days a week. So there's off days where you're allowing the hormones to bounce back, and so it's all very very nicely outlined in a treatment plan, and that's where a lot of people are lacking from Dr. TikTok is they're not understanding how to do this the most efficacious way.
gotcha. Okay.
Yeah.
Real quick, we're coming up on time here. With the GLP-1, so if someone wants to lose weight and they
Yep.
come to the clinic and say, okay, GLP-1 is a good fit for them, what
Yep.
does a GLP weight loss plan, action plan look like? Because the goal is to get their weight off and get them off the
Yep.
med. How do you do that?
So it depends on how much weight they want to lose. So that's why it's important to understand their health goals, and that's one of the things we strive ourselves on from the very beginning at MedMatrix with our patients is understanding their health goals because then it can give us an understanding of how long their treatment plan will be. So when we start with a patient, we get comprehensive blood work, right? We understand everything that's going on. The initial phase of care is really talking about their diet, talking about their lifestyle, things that need to be changed to support the GLP-1. So most GLP-1s we use for about 3 to 6 months, depending on their weight loss goal. A patient could lose a pound a week on a GLP-1. So if there's 100 pounds to lose, right? Do the math. That could be 2 years on a GLP-1. It could be longer. It could be less. It could be depending on how much weight we may use in conjunction with a drug, and then stopping the drug, and then continuing on with their change in their lifestyle and their eating habits, and then they've changed their entire routine. They're working out, they're eating better. And the one thing that's really important about the GLP-1s and also peptides in general is we we are trained with our peptide therapies to get people started on them, but also how to stop them. You can't just cold turkey these things. It's not appropriate. It's not a great idea, especially with the GLP-1. So part of their treatment plan is the beginning phase, during, and then how to come off of it, how to wean off appropriately, how to reduce the doses over a period of time. And that's something you're just not going to get from Dr. TikTok. So
Mhm.
that's a really important part of peptide treatment, is understanding how the tail end of the treatment looks, so that they maintain their goals, they maintain their results, and then we can safely transition them into another phase of their care.
Cool. That's awesome. Well, that's time. There's so much more we can talk about with peptide,
Totally.
weight
Yeah.
loss. I love doing these. We're definitely gonna keep doing them. Excited for the
Yeah.
next one. Um, if you're actually, Colin, let's bring us home. What's,
Yeah.
if you're trying to end it with a really good question here. with if someone's considering, they're thinking about, okay, I want to put my health first, do
Yeah.
peptides.
Yeah.
What are the what are the what are the three things that they should be doing on their own in their day-to-day life as far as like health practices, um,
To support the peptide,
to
you mean?
support peptide? Yeah.
So, like I said, peptides do not outrank a poor lifestyle.
Hmm.
So, for example, on a GLP-1, right? People shouldn't be drinking alcohol a lot. They should be eating the right way. They should be trying to do some sort of physical activity. So, there are things that need to be done in conjunction with the peptides. Same thing with
Hmm.
any other type of peptide, or if it's, like a BPC 157 or the Wolverine, like I was mentioning, you really need to be doing things that help the peptide work better. So, you need to be eating well, right? Poor diet is going to decrease the effectiveness of anything you do: hormones, peptides, herbs, supplements, whatever. Um, you also need to be sleeping really well, right? You need to be regenerating the body and getting good quality sleep so that the peptide works as part of the regeneration process. So if you're sleeping 4 hours a night, 3 hours a night, and you're trying to lose weight and you're trying to get your peptides optimized, they're not going to work as well because your body is not in that regenerative state where the peptides work. That's where peptides work, is in the regenerative state. Also, the diet's really important. Like I said, if your diet is not on par, if you're eating really poorly, processed foods, if you're drinking a lot of alcohol, a lot of sugar, the peptides are not going to work in synergism with the hormones because the hormones are not working because the diet is poor. So those are my top things that need to be done. And again, no one's perfect. We're not expecting perfection from patients, but there needs to be attempts at changing and modifying the way you live your life to get these therapies to work in conjunction with that.
Hmm.
It's
That's awesome.
hugely important. Yeah.
Yeah, and that's the difference about like working with a provider like you, right? It's like they're looking at
100%.
what can we do with
Right.
the best of medicine, but also like being serious about the lifestyle things that contribute
Right.
to that.
And it's
So,
my job, and sort of one of my final thoughts is, it's my job to help people find the way forward. Right.
mhm,
I can't go home with them and feed them and take care of them
right, so
24/7 so they live healthy. Right.
yeah.
That's a whole nother line of work I would be doing. It is my job to give as much education to the patient as possible, and for them to have a self-realization of, I need to change. I
Mhm.
need a change. I need it yesterday, but I don't know how. I don't know how to do it. I don't know where to start. I know what my goals are, but what do I do now? What do I do in 6 months? So it's my job and the job of the providers at MedMatrix to help guide and facilitate these care plans over a period of time. It's our job to motivate. It's our job to educate. It's our job to be accountability coaches, right? It's our job to slap you on the back of the hand and say, you're not doing the right thing. You have these goals. I need you to get back to it. So that is our job. That's a big part of our job. We can provide the medicine, we can provide the tools, but it's also a big part of our job to help people through the journey. The
Mhm.
journey's hard. It's hard. So it's our job to help people through the journey so they can get to their goals.
That's awesome. I
Yeah.
appreciate it. Colin,
Yeah.
thank you so much for your time, man. If
Course.
you are watching this and you're interested in becoming a patient in 2025 at Mid Matrix, we still have some spots open for anybody.
2026.
2026. Oh my gosh.
Yeah.
Getting up, get used to that.
Yeah.
We put the website in the comments. Go down there, click the website, click get started, and set up a conversation with the patient coordinator. We'd love to see if we can help you with your health goals in 2026.
I would love to
Awesome.
help you.
All right. Thanks everyone for joining.
Thanks, everybody. Happy New Year.